Hi, and welcome to Beacon Hill Update with Senator Jason Lewis. I'm Ryan Boyd, hosting on behalf of Wakefield Community Access Television. Welcome, Senator.
Hi, Ryan. Thanks for having me, and it's great to be back in the studio again.
It's great to have you here. So, I'm very pleased to have you here. You represent not only Wakefield, but Malden, Melrose, Reading, Stoneham, and Winchester. Is that correct? Did I get them all?
Yes, you did.
Perfect. So today we're going to talk about some of the recent work you've been doing on the Massachusetts Senate. I know one topic that's been on everyone's mind for the last 2 years almost now is the COVID-19 pandemic. So what is Massachusetts doing in its efforts to mitigate and address the public health crisis?
So as everybody knows, this has kind of upended, our lives, our communities for really going on almost 2 years now. And it certainly has dominated the work that we've been doing in the state legislature, working closely with Governor Baker and his administration and all of our local municipal officials. I would say where we're at, right now in Massachusetts is sort of there's good news and bad news. I guess I'll start with the bad news. Unfortunately, we are seeing an uptick again in COVID-19 cases in our communities and across the state. We've also seen some increase in the number of people who are being hospitalized for COVID-19. Nothing like what we saw in earlier surges, but we are seeing some increase. People are going back indoors because of the cold weather. We just had the Thanksgiving holiday. So that is unfortunately not great news. The good news, however, is that we've been doing a great job in Massachusetts and more broadly in New England in getting folks vaccinated. And the vaccines have been shown to be very safe, highly effective, and very effective at preventing serious illness and hospitalization. So if people still do get COVID, it tends to be much milder. And in Massachusetts, we're leading the nation in our vaccination rate. We are over 70% of the total population, including children, who are fully vaccinated.
That's outstanding.
And we're over 80% who've had at least their first shot. And actually, when I just looked at the numbers, we're over 90% of adults who are fully vaccinated. And remember, with younger children, it's only recently, that the vaccine was approved for them. And we are seeing lots of younger children now also getting vaccinated. So best thing we can all do is obviously get vaccinated if you're not already. Get your booster shot. I'm getting mine tomorrow. So definitely encourage everyone, now those are available to all adults. Get your booster. That just strengthens further your immunity. And, we are obviously continuing to follow precautions, like you and I are wearing masks as we're inside a school building where we're filming this show. And other precautions like that. But there's no plan to go back to the restrictions, that we had in place before. There's no plan to declare a public health emergency or put other restrictions in place for our businesses and our communities. But again, if everybody just gets vaccinated, gets their booster shots, get children vaccinated, take reasonable precautions when appropriate with masks and distancing, I think we'll be fine. And again, the key is preventing, serious illness and obviously as few deaths as possible. And if, when we're successful in doing that, that also means that our economic recovery, can really continue and can strengthen as well.
Absolutely, and I imagine most people would be glad to hear that, they're really, as far as anyone knows, unless something terrible happens, there is no plan to go back to a state of emergency or anything like that. And speaking as somebody who is fully vaccinated and still contracted COVID-19 myself about a month and a half ago, it could have been a lot worse than it was when I got it. Yeah, I think that the vaccine really shows that just like the flu vaccine. You get it, doesn't mean you're not going to get the flu, but it means your symptoms will be so much less than they could be if you didn't have it. So it's just so important.
And exactly to your point, I just saw the latest information from our hospitals, and although as I said, the numbers have increased, the folks that are being hospitalized right now are largely unvaccinated. So that's why it's important to be vaccinated. But even those who are vaccinated and there's breakthrough cases where they may have to be hospitalized, their symptoms are much milder, and they're much less likely to develop a very severe case. And so that is protecting folks from a severe case and from death.
Absolutely. So next up, we've been hearing a lot from Washington, D.C. about the Biden administration's American Rescue Plan Act and the Build Back Better Act. So how are these bills going to impact those here in Massachusetts?
So one of the things that has been really important in responding to the pandemic has been that it's taken a partnership between the actions of the federal government, the state government, and our local municipal governments. And everybody's had to pull together to respond, both to address the health risks, of course, and also to address the economic impacts. This pandemic's had a huge impact, of course, on many of our small businesses, our restaurants, our nonprofits, and it's been devastating for them. So earlier this year, when President Biden came into office, along with congressional Democrats, they were able to pass the American Rescue Plan Act. It's also known as ARPA. And that was really, really important legislation to provide a lot more support to help our state and our communities recover from the pandemic. Included in that bill was money that goes directly to states to then decide how best to use that to help the state recover from the pandemic. So Massachusetts' share was about $4 billion. So that's a significant amount of money. And so what the state legislature has been doing for the last several months is determining how best to invest those funds to help strengthen the recovery in Massachusetts, help our families that have been hard hit, our small businesses, our nonprofits, our hospitals and health centers, and so on. And actually, I'm really excited today, as a Friday, that we're taping the show. The state Senate just gave its final approval to the bill just before we started taping, so this is very timely. And so the bill is basically headed to Governor Baker's desk right now as we speak. We expect him to sign the bill very quickly. And so this will be providing hundreds of millions of dollars for a whole variety of important areas across Massachusetts, and this will help our communities as well as the whole state. So it includes funds to support our healthcare system. So that includes to continue to support our hospitals, particularly our community hospitals, our health centers, our nursing homes, and other long-term care facilities that have also been devastated by the pandemic. It also includes very significant funding to support mental health. And I know we're going to talk more about that later in the show. But there's a lot of funding in there to support, for example, being able to have more mental health providers in our state that are accessible to patients for patient care. Also in this legislation is funding for housing. Critical need, particularly in the greater Boston region, because we've seen rents and home prices go up so much, it's very hard to afford to live in this area. So this bill includes a lot of money to support more affordable housing programs. We have some great programs in Massachusetts, like the Commonwealth Builder Program, for example. We just need more funding, and this bill will provide a really historic opportunity there. Another major area is addressing climate change. So there's a lot of funding in the bill for programs to strengthen preparedness for climate change, for example, to deal with flooding, more extreme weather. We have something called the Municipal Vulnerability Preparedness Program in our state that's been very successful. Our local cities and towns have taken advantage of it. So, for example, this bill will provide more funding for that program. Also included in the bill is bonus payments of up to $2,000 for low-income essential workers who worked throughout the pandemic. Think folks who work in supermarkets, nursing homes, bus drivers, others who, they had to stay on the job in person. They couldn't work remotely during the pandemic. They put their own health and lives and that of their families at risk. We think we owe them. And this bill includes actually $500 million of the bill, so a very significant amount is going to be going in terms of bonus payments. We'll work out the exact details of how much people get, but that's going to happen in the coming months.
That's wonderful.
And then one other important area of the bill is we also are contributing a significant amount to the state's unemployment insurance trust fund, because so many people became unemployed, that drained the state's unemployment trust fund. If we don't put this money in it, that burden will fall on our businesses because they'll have to make that all up. And we think it's only fair that we contribute something to help support that fund to recover. So that's included as well. So those are just some examples. There's other things in there as well. One other thing I'll mention is that I was able to work closely with our state representatives in our communities in this area to secure some funding for local priorities as well. So we were able to, just some examples, funding for the Albion Cultural Exchange for accessibility improvements there, funding for the Greater Boston Stage Company, which is a regional theater, for COVID upgrades. We got funding in there for a new solar array at the Stone Zoo, funding for the Malden River Works project, a whole host of local projects and priorities that we were able to fight for and include. So I'm really excited about that as well.
Yeah, sounds like a lot of great localized, very important things are being addressed and taken care of, and that's great to hear. Asking for a friend, but you know, as a nonprofit, you know, organization ourselves, or you know, plenty of other ones in the town, in the state, all around, you know, we haven't seen a lot of guidance on, you know, how do we, if we wanted to apply for, you know, for some funds in some way, how does that happen? Now, do you know if, you may not be able to answer this, maybe it's more a municipality, on the municipal level, but, you know, how would small businesses, nonprofits, try to, you know, get some assistance with this bill passing?
Absolutely. So there have been a variety of programs, you know, from the beginning of the pandemic. Some of those have been federal, like the Federal Paycheck Protection Program and the Shuttered Venue Program. Some have been state programs, which we've used state money. So just like those previous ones, this new money will then go into programs that will get rolled out. Some will be existing programs that get new money. Some might be new initiatives. And we'll just be getting the word out, you know, working together with Governor Bacon and his team. And there will be a variety of opportunities, you know, for small businesses, for nonprofits, for arts and cultural organizations. For example, there's money in this bill for the Mass Cultural Council to give additional grants. And so that will be a way that, you know, our arts and cultural sector will be able to get more support. So things like that. So I would say to folks, stay tuned. You know, in the coming weeks and months, more details will come out as to exactly how to apply for different sources of funding.
Should folks, and last question on this and I'll move on, but should folks be concerned, is this a first come, first served situation? You know, if someone waits too long, all the funds are gone, you know, how quickly should folks try to get in on this?
Generally not. I mean, there are kind of well-structured ways that, you know, these different funds will flow, you know, again, mostly through systems and processes and programs we already have in the state. And there are usually criteria, you know, eligibility criteria for these different programs. But I'm not overly worried about that. But I do think that, you know, organizations should try to, respond in a timely fashion once the details are put out there for this program, for say small businesses. You know, this is what you need to do to access grant funds. You know, it's good to certainly do that in a timely manner, but I'm not overly concerned about that. And the other thing I would add is this bill that we just are sending to the governor today doesn't appropriate the entirety of the money that the state received from the American Rescue Plan, because we wanted to do this in phases. So there will also be another a bite at this apple next year. And so we're going to continue to keep a close eye on the pandemic, on the economic recovery, on where the greatest needs are, you know, in our communities, and then we'll respond to that with, some additional investments.
Okay. Thank you so much. So, Senator, another prominent policy issue that in recent years has been the question of voting access and voters' rights. So, can you talk about the recent Senate voting bill?
Definitely. So, one of the things, maybe a silver lining, if you will, of this pandemic is that it has forced us to do some things differently. And one of those things is that here in Massachusetts, for the first time, we allowed people to vote by mail. I mean, it is the case that for a long time you've been able to vote by mail if you had if you couldn't get to the polls on election day, right, you had to have an excuse, like you were going to be out of town or some other reason. But because of the pandemic and the health concerns, we did pass an emergency law back in 2020 that allowed for secure voting by mail. We also included much more early voting so that you could go to your local town hall or city hall and you could vote early, and these are all providing multiple options to people, because of course you can still vote on election day if you prefer to do that, but then you can vote early if that's more convenient for you, or you can vote by mail. So those provisions, though, are coming to an end now because it was during the emergency of the pandemic. What the Senate did in passing this bill called the Votes Act, we passed it a few months ago, it would make these reforms permanent. So even after the pandemic, for our elections going forward, we would continue to allow for no excuse, vote by mail, absentee ballots, and we'd have a process for getting those ballots out to people who need them. And then you would just either mail it back, or you could put it in a drop box if you prefer to do that. You'd also make sure you have substantial early voting opportunities for people, including a weekend, and then you could vote on election day. The other thing that the Senate bill included, which I've been pushing for years, is what's called same-day voter registration. So this is really important for young people, for people who may have just moved. Means you can go in on election day, you can show the relevant ID to prove who you are and where you live. You then essentially register to vote that day, and you cast your ballot. It's typically a provisional ballot, because we do have to register, the city or town clerk has to confirm that, but then you are able to cast your ballot. So that's included. So it's I think it's very important legislation in terms of voting rights, and the bill has now gone to the Massachusetts House of Representatives. I'm very hopeful that they will take up the bill soon, and we can get this across the finish line. Because when you look around the country, unfortunately, we're seeing in some states that are controlled by Republicans that they're going the opposite direction, and they're actually making it harder for people to be able to cast their ballots. I'm proud that here in Massachusetts, we are trying to make it easier and more convenient for eligible voters to safely and securely cast their ballot, and that's what we're going to stay focused on.
Okay, great. Now, we've talked about the pandemic already. 2 years now in March, I guess, will be when things shut down, emergency declarations were put in place.
Incredible that it's been that long already.
Unbelievable,
right?
isn't it?
And we're still dealing with it.
The toll that it has taken on people mentally is I don't think it can be overstated when we talk about it. So, can you talk to me a little bit about anything that is happening on the state level to help people that have been struggling during this time, and how they can reach out for help?
Totally. So glad you brought this up, because it's been the mental health crisis, and it really is a crisis, is a great concern, and it's been very significant also among our children. We really have a pediatric mental health crisis, but also many adults as well. Now, it's not something new. I mean, even before the pandemic, we had a lot of problems, I think, and challenges in our mental health care system in Massachusetts. People having difficulty accessing the care they need in a timely manner, insurance covering the cost for mental health care. So that was already a challenge and a problem. Pandemic has made it so much worse, and so many more people are in need of care. I believe personally that health care should be a basic human right, that nobody should be denied the access to the care, whether that's care for a broken leg, a heart attack, diabetes, or for depression, anxiety, PTSD, whatever your condition is, whether it's physical or behavioral health, mental health, and that includes substance use as well. You should be able to get access to high quality care that's timely, convenient, and of course affordable. The problem is that we are supposed to have mental health parity in our state, which means that you have mental health is treated the same way as physical health, but the reality is that's not the way it works today. And every day I hear from constituents who are struggling to get the mental health care they need. So this has been a priority for the state Senate, for a long time. I mentioned earlier that in the bill we just passed, so-called ARPA bill, we included several $100 million specifically targeted at strengthening mental health care access. So this bill, so the Senate also, in addition to that, also recently passed a major bill addressing mental health that I'm very excited about because I think it will really make a big difference for our state. And briefly, what that does is it puts more teeth into the enforcement of mental health parity. So even though that's supposed to be the case, it hasn't really been enforced. So this bill would make sure that there is enforcement and oversight to make sure that insurers and providers and the whole healthcare system does provide and deliver mental health care the same way that we expect physical health care. The bill would also include an annual mental health wellness checkup for everyone, just like how you can go for your annual physical and that's covered by insurance. Why shouldn't we have the same thing for mental health? So that would be included as well. The bill would also deal with this terrible emergency room boarding situation that we're seeing, where children or teens and sometimes adults end up in the hospital emergency room and they can't get placed in a psychiatric bed which is what they really need because there's no beds available, that provide the care they need. So it results in boarding in emergency rooms, which is just an awful situation. So the bill includes a variety of strategies to address that. And then, very importantly, the bill includes various strategies to support the mental health workforce. So think, nurses, physicians, psychiatrists, counselors, behavioral health therapists, a whole range of different folks who work in this field. It has things such as scholarships for colleges, university, loan forgiveness programs to help people, enter the field even if they have a lot of debt from school, from college and graduate school, and is really designed to significantly increase the number of people that are well-trained and skilled and are available to work in Massachusetts to provide mental health care. Because we do have a shortage right now, particularly in this field, and that's one of the things that's limiting access. So this is a really important bill. I'm really glad to have supported it. The Senate passed the bill. I believe we passed it unanimously, so it was bipartisan. And this bill is also now over in the House of Representatives. So again, we're hoping that this will be a bill that they will take up as well.
Yeah, that'd be so important, if you're already able to pass and be what you want it to be. One question I do have about it is, all the money in the world for it won't matter unless people are willing to say, I need help. And I feel like there's still such a stigma out there for folks who might need to go talk to somebody, go see somebody, but either feel afraid to or embarrassed for whatever reason. And is there anything in the bill, or is there anything else that the legislature is doing to help get word out there that you're not alone, it is okay, and we all face certain things sometimes?
Yes, that is such a great point you're making, because it's there is unfortunately like a stigma associated, still with seeking care for mental health or for substance use, right? And we've got to get past that. There should be no stigma whatsoever. It should be no different, if you're dealing, again, with whether you had a heart attack or you have a chronic illness, like high blood pressure or diabetes, or you have a mental health condition. There should be no difference whatsoever. You should be able to get the care you need. And we have made progress in this area. I think we've come a ways because we're talking about it more, like you and I are doing right now. Yep. This is the kind of thing we need more folks in our healthcare system and community leaders and others to be talking about the importance of accessing mental health care when you need it. So I think we're doing better. I think that stigma is starting to fade, but you're right, it's still there, and we need to do more to address it. And there are some things we've been doing in the last few years in terms of public awareness campaigns and other things. And a lot of our healthcare providers, by the way, are doing a great job also to get the word out. Some of our local hospitals are doing this and others. So I feel optimistic that we are making good progress, but I do agree with you that it's something that is a barrier for some people to get the care they need.
So before we close out today, if I'm not mistaken, you are the chair of the Education Committee, correct?
That's right. I actually wear two hats, right? One hat is I represent Malden, Melrose, Wakefield, Stoneham, Reading, and Winchester. That's kind of my day job. And then the other hat I wear is the Senate Chair of the Education Committee. So I do spend a lot of my time in the legislature on education policy.
So tell me, what can you tell me about it? Are there any updates? Anything that we all should know about?
So I really love serving as the Senate Chair of Education. I've been doing that for about 3 years now, and had the great good fortune to work on and help pass what's known as the Student Opportunity Act. That was back in 2019. And that was about making sure our schools are adequately and equitably funded. So one of our priorities is to make sure that we continue to implement the Student Opportunity Act and follow through on the legislation, which we are doing. And that's really helping all of our school districts, particularly our school districts that serve large numbers of low-income students with, who are English learners and special needs. So that continues to be a priority for us. Another area that's a high priority for the Education Committee and for me is early education and what's known as out-of-school time care. So what we're talking about here is children from birth through kindergarten. What kind of care and access do they have, and what options do families have? And also for children who are in elementary school, what are the options for care after school, before school, and during vacations? So we are working hard on legislation to significantly expand access to affordable, high-quality early education and care. That's really getting a lot of attention right now. And fortunately, it's also getting attention in Washington. And President Biden's Build Back Better Act, which we are hoping will pass the Senate soon, includes new funding for early education and childcare. So we at the state level want to be ready to implement that and to build on it to make sure that many more families, low-income and middle-income families, can access, high-quality, affordable care and continue to maintain a wide range of choices so families can choose what's best for their child, but that it's more affordable, because right now it's so hard for families, even upper middle-income families, to afford the child care that they need.
Absolutely, and I can only speak for what I see here in Wakefield. With we're right here in the high school, so we get to see a lot of the students, a lot of the teachers, and the interactions they have, and the work they do is unbelievable. And never mind on a normal year, but the last couple of years, with the pandemic, with remote learning, with all of these things, and I feel like the teachers have been the unsung heroes of the pandemic.
They are
here.
Heroes.
It's been unbelievable.
Incredible how they had to pivot to just overnight doing everything virtually. My wife's a teacher as well, so I've seen it personally with her. And then coming back in person, we did even before there were vaccines, and just what they've had to navigate. So for both our K through 12 teachers and staff and our early educators, who continue to be in person through the pandemic, we owe them a huge debt of gratitude.
We all do, absolutely. Senator, thank you so much for joining me today. It's great having you back here in studio, and I look forward to having you again soon.
It's been my pleasure, and thank you so much, Ryan.
And thank you all for joining. We'll see you next time.